Welcome, everyone. Thanks for joining us today. We'll get started in just a few moments here. All righty, Cleo, why don't you kick us off?
Great. Good afternoon or morning to those of you on the West Coast. My name is Cleo Hirsch, and I am the Deputy Director of Public Health AmeriCorps, and we are so excited to have you, Public Health AmeriCorps members, joining us today to hear a presentation from some of our fantastic partners in the public health field, who you might not know it, but have been behind the scenes rooting for you, watching you progress through this program as the first national cohort of Public Health AmeriCorps members. And they are so excited about your talent, your energy, and your future as public health leaders in this country. And so today, we are so excited to have all of these fantastic partners come together to share a little bit about who they are and what they can offer you as you launch your public health career through AmeriCorps and through this program. So what I'm going to do is I'm going to just briefly run through who all these fabulous partners are who are here today. And it might feel a little bit like alphabet soup. And if it does, I will say, do not stress, because I myself am new to public health and this field. And when I first got involved in the field of public health, I also felt overwhelmed by all the acronyms and all the organizations. And it's definitely a lot to take in. But only a few years into my professional journey in the field of public health, I now know all these players and know what they have to offer and to bring. And it has really helped me in my own career journey to be able to leverage the support and resources and expertise of our partner organizations that we have on the call today, as I pursue my own journey. And so really our goal for you all today as Public Health AmeriCorps members is to just get the chance to hear from all of these fabulous organizations that are rooting for you and have resources for you. And then also learn about a very exciting scholarship opportunity that APHA, the American Public Health Association, has to offer some of our members to attend their national meeting in the fall in Atlanta. So we have a really packed agenda for you today. So your two goals should be to listen and learn from all of our partners. And we do have slides and additional resources. So we'll follow up from today's calls with those. So don't feel like you have to write everything down, just take it all in. And then, of course, learn about this scholarship opportunity and the steps that you can take if you're interested in applying. So before I pass it over to our partners at APHA, I'm just going to run down the list of all of the organizations that are here today to speak with you. We have the American Public Health Association, known as APHA, and what they are is a professional membership and advocacy organization for public health professionals in the United States. We have, of course, the CDC. As you know, PHA is a partnership between the CDC and AmeriCorps. And so they are really responsible for making this incredible program happen. And I'm sure you've heard of them. But the CDC stands for the Center for Disease Control. And the Center for Disease Control and Prevention is the National Public Health Agency of the United States. We have ASTHO, which is the Association of State and Territorial Health Officials. So they support state health departments and territorial health departments to advance health equity and optimal health for all. And then we have NNPHI, the National Network of Public Health Institutes. And they're going to talk a little bit, I believe, about their Learning Navigator and some of the great resources they have pulled together for those starting out on their public health journey. And then we have NACCHO, the National Association of County and City Health Officials. So I know many of you are serving at local health departments. So this is the national group dedicated to serving every local health department across the nation. And so they have that really broad perspective. And all of these partners are working every day in the background to make Public Health AmeriCorps possible. And they've heard so much about you, our members, and how incredible you all are. They've been tracking the work you're doing across the country, and they really wanted to get the chance to introduce themselves and share a little bit about what they have to offer you on your public health career journey. And so that's what today's call is all about. So I will pass it back to Raya, or perhaps to Dr. Benjamin. Raya, I'm not sure, you can lead the way here to kick us off. And thank you all so much for joining. I hope today's session is fruitful. And again, we will follow up with resources and information after the call. Thank you.
Cleo, thank you. And Raya, thank you very much for your support for this this event today. I'm Georges Benjamin. I'm the executive director here at the American Public Health Association. And we may very well have some of our colleagues on the line here who are have low vision, or who may be without vision. So I'm an African-American male. Just to give you an idea of who I am, I wear glasses. And my background for this call is the APHA logo, just to give you a sense of what I look like. I would like to begin our conversation today with a land acknowledgement. We at APHA are here in Washington, D.C., where we're broadcasting this virtually. And as many of you know, Washington, D.C., the District of Columbia, is the traditional land of the First Peoples on Piscataway, who had this region. They inhabited this region between the Potomac River and the Anacostia Rivers. They're the original inhabitants of this land for thousands of years. And today we want to just certainly acknowledge them and honor their history and express their gratitude to them for the land that has provided us with this bounty. With that said, here's our agenda today. Cleo just went through our core partners for this initiative. We're going to talk a bit about the resources that we have here for you. Talk a bit about, as you heard, the APHA annual meeting that's this fall in November in Georgia, and then talk about other resources that we have, future webinars and other opportunities to participate in this program. We can go to the next slide. So, you know, as I said, I'm a physician, and you know, I think a bit about, yeah, that one right there. Thank you. I think a bit about public health, just to give you a sense. I used to practice emergency medicine, and as an ER doc, I cared for individual patients who came in the door. I provided them care when they were sick. I provided preventive care for them. I encouraged them to improve their health, but I did so on an individual basis. What makes public health different is that we try to do things on a population basis. So while individual physicians and nurse practitioners and PAs and other healthcare providers provide care, and their concern is on that individual patient in front of us, public health tries to do things on a population basis, things that influence the care and health and well-being of whole communities. So by the tens, by the hundreds, by the thousands, by the millions. If we go back, APHA is a professional society. I'm not sure why it's jumping around. There we go. Go back. There we go. APHA is a professional society that is a collective of individuals who have an interest in improving the health of folks. We've been around for a little over 150 years. And our goal, of course, is to improve health through policy. Next slide. There we go. And here's the APHA annual meeting. You'll see this again. I mentioned that it's in Georgia this November, in Atlanta, and hopefully many of you will be able to participate in that meeting. Next slide. You know, one of the other interesting things about public health is that public health is a collective of many people across many disciplines. And so while we in public health see ourselves in a defined scientific discipline, we collaborate with a lot of people, private sector organizations, business communities, the media, other nonprofits, other organizations that are interested in the public good, elected leaders, obviously, both in this administration, at the city, state, local level, as well as with Congress, in order to try to improve the public health. And so public health is a collaborative practice. And so you're part of this is being part of that collaborative practice. And I think with that, I want to turn it over to Angie McGowan. I want to thank you very, very much for being part of this program. And we're really excited that you're here. Angie is the director of our Alliance for Disease Prevention and Response here at the American Public Health Association. Angie.
Thanks, Dr. B, as we call him. I'm so glad to have you here, and it's so great to see all of you all. Just for the introduction, I'm Angie McGowan. I am sitting in my office. I have a dress and a black sweater on. I'm a white woman with brown hair. So we are so excited to have a chance to now introduce some of our other partners who are working with on this work. You heard from Georges Benjamin a little bit about the work that we're doing around advancing public health. And so I believe that I will now, I'm going to let our partners introduce themselves. But first, a really important partner in all of this, who hopefully you all know about, is CDC. And so I'm going to turn it to Stephanie Dunson to tell us a little bit about CDC and how excited they are about the program.
Thanks so much, Angie. I appreciate the opportunity to be here with you all today. As Angie mentioned, my name is Stephanie Dunson, and I work at the Centers for Disease Control in Atlanta, Georgia. And I challenge all of you to find out and figure out why CDC is headquartered in Atlanta. So I am a light-skinned African-American female. I have a blue and white CDC logo background. And as I mentioned, I am in Atlanta, Georgia. So again, thank you to APHA and the Public Health AmeriCorps team for allowing me to join you today and share a little bit more about CDC. I currently work in the Division of Workforce Development in the National Center for Tribal, Local, and Territorial Public Health Infrastructure and Workforce. I know that was a lot to take in. We just recently changed our center name, but that's where we are now. I am on the policy team where we coordinate policy requests and actions from Congress. We facilitate fellowship recruitment and partnership collaborations like this one with APHA and Public Health AmeriCorps. We are excited to have you here to learn more about public health opportunities, where you can touch people's lives and enjoy the places that you'll be able to go and work within public health. Next slide. Oh, okay, there it goes. So you might ask, what is CDC? It is the nation's leading science-based, data-driven service organization that provides the public's, that protects the public's health. For more than 70 years, we put science into action to help children stay healthy so they can grow and learn, to help families, businesses, and communities fight disease and stay strong, and to protect the public's health. CDC works 24/7 to protect America from health, safety, and security threats, both foreign and in the US, whether disease starts at home or abroad, or acute or chronic, curable or preventable, human error or deliberate attack. CDC fights disease and supports communities and citizens to do the same. CDC increases the health security of our own nation, and we are known as the nation's health protection agency. We save lives and protect people from threats. So CDC's role in protecting public health includes detecting and responding to new and emerging health threats, tackling the biggest health problems causing disease and disability for Americans, putting science and advanced technology into action to prevent disease, promoting healthy and safe behaviors, communities, and environments, and developing leaders and training and training the public health workforce, including disease detectives, and taking on the heart pulse of our nation. So when you have a moment, I want you to take a look at the cdc.gov website for more information. Next slide. Okay. So one of our premier fellowship opportunities at the CDC is the Public Health Associates Program. And this provides early career public health professionals with hands-on experience working in public health agencies and organizations across the country. This program helps to strengthen the frontline workforce of the public health system and builds the next generation of skilled public health professionals. Since it started in 2007, the Public Health Associates Program has hired more than 1,800 associates. The three main components of the Public Health Associate Program is to provide experiential hands-on learning and is meant to serve as a training program to early public health professionals. So I mentioned this fellowship opportunity first as a possible next step for you in your public health career. I would encourage you to check out the website when you have an opportunity to learn more about the PHEP program. So we also have a ton of other fellowship programs at CDC. So whether you are on track for public health or you're deciding which career you would like to pursue in public health and or medicine, CDC has many diverse fellowships, internships, training, and volunteer opportunities for students and professionals. Many of these opportunities provide invaluable experience and potentially offer clear-cut paths to exciting careers at CDC. One thing I did not mention on this slide is the usajobs.gov website where you can go and apply for federal careers. So when you have an opportunity, it's usajobs.gov website, and check that out for opportunities at CDC and other federal agencies across the country. So here's just a snapshot of some of our fellows in action. As you can see, we have people all over doing all kinds of things. And one day we would love to have your smiling face here as well. So thank you for the opportunity to present to you today, and we wish you the best of luck on your journey. And we're also excited to welcome APHA to Atlanta in November. Thank you.
Thanks so much, Stephanie. As you all can see, we're certainly lucky to be able to work with the AmeriCorps program and with CDC, and we are looking forward to having a chance to be in Atlanta with all of them in November. I'll now turn it over to my colleagues at ASTHO, Joanne and Ashley.
Thanks, Angie. Greetings, everyone. I'm super excited to be here with you today. My name is Ashley Nyanthabongsa Mosley. I'm the Senior Analyst for Workforce Development at ASTHO, the Association of State and Territorial Health Officials. I am a biracial woman of Asian and Indigenous Mexican descent. I have on red glasses and a polka dot shirt. And just wanted to start with a land acknowledgement. My current residence is in Northern Virginia. I wanted to pay my respects to the Potawatomi and Manahoic tribes who previously inhabited this land. So I'm going to go ahead and kick us off, and then you'll hear from my colleague, Joanne. So ASTHO is a membership organization for chief health officials from 59 states, territories, and freely associated states. We also support peer communities of other state and territorial health leaders and senior executives in governmental public health departments, including senior deputies or leaders who are second in command, public health lawyers, chief financial officers, human resource and workforce directors, policy staff, and environmental health specialists, just to name a few. Our mission is to support, equip, and advocate for state and territorial health officials in their work of advancing public health and well-being. So we have nearly 300 employees overseeing programs and services on behalf of our members. And we are organized much like state health agencies. We are active in health programs, including areas as emergency preparedness and response, maternal and child health, chronic disease prevention. And we also have executive and operational functions like budgeting and grants management, planning and public relations, and communications. Finally, we have a cross-cutting team in areas that support all of ASTHO, and these include our instructional design team, our training team, our workforce department, our workforce team, and the health equity team. Some examples of work that ASTHO units do together include national level advocacy around health issues, policy and position statements, blog and recorded newscasts, trainings, professional development for state health officials and their employees, and hands-on technical assistant for state agency staff. A special plug today for one of our workforce projects that brings us here today is to connect Public Health AmeriCorps with our members so that 1, new members might serve in state or territorial health agencies, and 2, alumni of Public Health AmeriCorps find positions in state and territorial health agencies following their service. I'm going to go ahead and turn it over to Joanne to talk a little bit about ASTHO resources that could be of interest to you all.
Thanks, Ashley. I'm gonna, if you don't mind, the slide does not advance. If you would mind advancing this slide for me. Happy to be here with you all. As my colleague Ashley introed you, my name is Joanne Pearsall. I'm Director of Workforce Development at ASTHO. I go by the pronouns she, her. I am a mostly brunette with a little bit of a gray streak in the front. I am wearing glasses. I have a bright green shirt on with the bow, and I'm standing in my home office in Columbus, Ohio. So Ashley already mentioned some of the work that ASTHO does that we are regularly engaged with. Here are some selected resources that would be potentially relevant to you as Public Health AmeriCorps members. This slide shows the look of some of our products. We have a couple of conferences coming up. One next week is our 2023 Health Equity Summit, and we have a Techs Expo and Futures Forum coming up in May. Insights and Inspiration is a regular event that we hold designed just for that purpose, to inspire and provide insight to public health and public health issues. Our online learning courses and content, which you can find at learn.astho.org. Many of those courses that are on that site are open to the public and free. And we also recently launched a Public Health Hero, which stands for Health Equity, Resilience, and Opportunity Resources Center, to promote well-being in the public health workforce. Luckily, there's a way for you all to stay abreast of public health happenings and ASTHO work. I invite you to stay connected with us, whether you're a seasoned pro or you're just starting out in the field of public health. You'll likely find some of our products of interest. You can get all the news about the offerings that I just shared with you through our weekly electronic newsletter. We also have special announcements about upcoming events, whether they're in person or virtual. We do occasional news releases and legislative alerts. You can sign up for any of these types of resources by going to astho.org/newsletter. We also have a Public Health Review Morning Edition, which is a daily newscast featuring public health happenings. And you can get this newscast almost anywhere that you can get podcasts, whether it's Apple, Spotify, Google, Alexa, and more. ASTHO does have a social media presence. Be sure to connect with us on social media. You can find us on Facebook, Twitter, and LinkedIn. And lastly, I'm most excited to share with you our publichealthcareers.org website, which was launched in the fall. This website is dedicated to promoting careers and jobs in governmental public health agencies. We're continually adding new features and new content, and we'll soon have a section dedicated to Public Health AmeriCorps. And that will include a career assessment that will allow you to answer questions about your interests and preferences and match you with potentially suitable roles in the field of public health. So when the time comes, we hope that you will find the site and learn more about careers in public health and perhaps find a match with your dream job on publichealthcareers.org. So this is us. We hope to be a resource for you. We invite you to connect with us. There's an easy way to remember this rather than our names at ASTHO.org. You can simply email either one of us at workforce@astho.org, and we're both on LinkedIn as well. I will turn it back to you, Angie.
Great, thanks so much, Joanne. Just for everybody, we will share these slides and the recording after this event, so you can capture all this information later. I'll now turn it over to Laura to tell you more about the National Network of Public Health Institutes.
Thank you, Angie, and thank you, APHA, for giving us the opportunity to be here and to speak directly to the Public Health AmeriCorps members. My name is Laura Prechter. I'm an Associate Director for Training and Workforce Development. I am a white woman in my home office wearing glasses and a white top. I'm based in New Orleans, Louisiana, but NNPHI has representation all over the country. So what is NNPHI? So at its heart, NNPHI is the National Network of Public Health Institutes. And I think it was Cleo that mentioned how many acronyms we work with in public health. So don't try not to be intimidated by all the letters we're throwing around. There's time to absorb it all. But NNPHI is at its heart, again, a member network for public health institutes around the country. So what is a public health institute? A public health institutes, they're nonprofit organizations dedicated to advancing public health practice and making systemic improvements in population health. Public health institutes work closely with their state, local, territorial health departments. They work closely with federal departments, and they do a lot of public health programming for their region. The benefits of working with public health institutes is that they can move quickly to hire staff, implement programs, they can re-grant and manage some subcontracts, they act as fiscal agents, they're nonpartisan, and they have a strong network of public health experts. So you can see on the map that we have public health institutes in most states in the country and some under active development. And we're working toward the goal of having a public health institute in every state in this country. So, NNPHI, we work with the system of public health institutes, but we also do a lot of programming ourselves. We work in portfolios, so we have programmatic work in communications and convenings for the public health workforce. We have a health and racial equity portfolio. We work in climate and crisis preparedness. Evidence to action is our research and evaluation portfolio. If you're interested in research, we're always hiring in all of these portfolios. Bridging is our bridging public health to other sectors portfolio. It's about making connections with health systems, with other systems that we don't traditionally touch in public health. We have a strong finance and administration department. And we have the portfolio that I work within is the National Coordinating Center for Public Health Training. So we call that NCCPHT for short, and we work on programs that are related to workforce development, training, education for the public health workforce. And that is where our programmatic work with Public Health AmeriCorps sits. So what is NCCPHT? It is, again, my portfolio at NNPHI. The mission of the National Coordinating Center is to advance and support capacity building, increase competency and performance improvement for the nation's current and future public health workforce. So we want to work with the entire workforce pipeline. We envision a capable, multidisciplinary public health workforce that's reflective of the communities that it serves. and then has access to the resources, tools, and training needed to advance health and racial equity and improve the health of all people. We have a lot of activities and resources within our portfolio for the public health workforce. We do a lot of training activities. We have coaching programs. We have convenings. Our upcoming NNPHI annual conference is just one of them. We have online communities of practice. One of our biggest ones is Public Health Improvement Network. We work with people who are at state and local health departments who are doing quality improvement work. So if you want to learn more about that world, we've got plenty of resources available. This list of resources, it's just a some of what we have available for the workforce, but these are kind of our highlighted programs. The Public Health Learning Navigator, I'll talk more about in the next slide. We offer learning pathways. So those are groupings of trainings that are available for the workforce into topic-based competency mapped pathways. We have the NCC PhD Digest is a newsletter that you can sign up for to get the latest, reports from the field of workforce development and job listings from NNPHI and from our Public Health Institute network. Elevate is a twice yearly publication about public health workforce topics. And we recently launched with the support of our, actually led by our Public Health Training Center partners, is a racial justice competency model that's available online. And we are going to be doing a pilot phase coming soon. So we work with a lot of different partners. I mentioned the Public Health Institutes. The Public Health Training Centers are university-based public health training centers around the country based on the 10 HHS regions. Public health training centers are an excellent point of contact for incoming workforce like you all, if you want to see what free trainings they have available, if you want to connect with a training center and try to learn more about a different topic that you might be interested in exploring in the public health career world. We are very excited to partner with AmeriCorps and Public Health AmeriCorps specifically for this work. We work with a lot of health departments, community-based organizations, and other, national associations and nonprofit. So I will talk in depth about one of our programs, which is the Public Health Learning Navigator. So the Public Health Learning Navigator, in short, is a website, a curated list of online trainings. So we have a peer review process. So what we do is we take training nominations from all over the country of people from different public health training centers or different universities that create online asynchronous public health trainings for the workforce. So I think this would be a great resource for people in Public Health AmeriCorps, for all of you to go online, search by topic, and find a training in a subject you're interested in or working on. You know that if you go to the website, every training has been peer reviewed based on our quality training standards. We also are always recruiting for new peer reviewers. So our peer reviewers are a volunteer pool. We train people on how to identify a set of quality training standard indicators, and then we will make training review assignments. And then you would go online and you would take the training and you would fill out a form, and it's a great way to get some volunteer time in, but also to take trainings and actively participate in this tool that we have available for the public health workforce. So it's open to anyone in the public health workforce pipeline. You can tell us what topics you're most interested in, and we'll try our best to give you trainings on that topic. You can also always decline a training review if you're overloaded in the moment and you just don't have time to do it. But currently, the Learning Navigator has over 150 trainings on a huge variety of topics, including community engagement, systems thinking, equity, data collection, cultural humility. And you can always contact us through the Public Health Learning Navigator. If you're interested in other resources, you're not finding what you need, we have a whole library of trainings and webinars and resources available to share with you. Caitlin put in the chat where you can sign up to become a reviewer. That link will also lead you to the Public Health Learning Navigator. Again, if you are just interested in sort of any topic in public health, you can go on there, search by topic, and find what you need. And they're all online asynchronous trainings, so you can take them as you have the time available and stop and come back. Most of them are free. I think we only have a couple that require payment for access. So that's just a little bit about what we do at NNPHI and within our NCCPHP team. I encourage you to check out nnphi.org. I'll put that in the chat. Just learn about any of our portfolios, any of these topics, get connected with our partners, our Public Health Institute partners, and our other network of public health partners. And we always have jobs available once you're out of the PHA network and ready to start applying. Thank you again, Angie, for the opportunity. I'll pass it back to you.
Thanks, Laura. As I put in the chat, you can tell how excited everybody is to have a chance to work with you. And hey, they're already offering you jobs. So hey, what more could you want? I'll now turn it over to our second Ashley of the day from our National Association of County and City Health Officials.
Thank you very much. Hello, everyone. My name is Ashley Edmiston. I am Director of Workforce and Leadership Development at NACCHO. I use she, her pronouns. I am a white female with long red hair sitting in front of a teal background. And I am joined today by my teammates, Mackenzie Galloway and Kathleen Szymanski. Next, please. So NACCHO, we are the membership organization that supports the nearly 3,000 local health departments across the country. So we provide advocacy, we provide resources, we do a lot of programmatic work to help support those health departments. And just a note, because this is always a question of how do you pronounce it, it is NACCHO, it is not NACCHO. Although sometimes I wish it was NACCHO, because that would just be such an amazing opportunity to do some fun merchandising. So as I said, we support local health departments. What do local health departments do? Some of you are at local health departments, and it's so great that you are getting that experience. So local health departments do a lot of things in their communities, but ultimately it is kind of grounded in the 10 essential public health services, which you can see here. You have the 10 services around the wheel, and it's surrounded by the 3 core functions of public health. So this is really a framework that describes a strong public health system. And as you can see, it is grounded in equity. So this is what our members are really striving to help do with their communities, both themselves and with their community partners. And what we at NACCHO strive to really help them to do and support those efforts. So just a couple fun facts. When I started at NACCHO, one phrase that I heard a lot was, if you've seen one health department, you've seen one health department. There is a whole lot of diversity across health departments. So just a couple of interesting statistics from our 2019 profile. So the largest health department in terms of staff is the New York City Department of Health. They have about 7,000 staff. The smallest is the Sunderland Board of Health in Massachusetts with 0.15, can't forget that 0.1 FTEs. In terms of jurisdiction size, so the communities that they are serving, LA County is the largest. They serve 9.5 million residents. And the smallest is again in Massachusetts, the Aquina Board of Health at 327 residents. So kind of a supplemental fun fact of the nearly 3,000 local health departments that we serve, 350 of them are in Massachusetts, which describes or explains a couple of these numbers. So I just wanted to highlight a couple of resources that might be of interest to you if you are just wanting to learn more about either local health departments or just what does public health look like at the local level, at the community level. So looking over to the right, we have our Roots of Health and Equity course. This is one of our signature programs at NACCHO, and it's really for people who are interested in implementing strategies that are affecting some of those societal drivers that lead to these health inequities. So those root causes. It is a free course. It can be taken either by yourself or actually you can take it in a group. And there's a number of modules that you can go through. It goes through the history of health inequities. It also goes through against some of those societal influences like class and gender and race. There's a module on public health narrative, and it's all very much based within a social justice framework. So I would say if you look at anything actually across our website and our resources, I would definitely recommend this one as a great place to start. And then just looking down a little bit is our MAP program. So this is another signature program. It's been around for about 20 years now. It stands for Mobilizing for Action and Planning and Partnerships. And it is a community-wide strategic planning process. And I wanted to highlight this especially because whether you are at a health department yourself or whether you are serving at one of our community-based organizations, that you might be involved. I hope you're all involved in this process. It's typically driven by the health department or sometimes by a hospital in the system. But it's really focused on assessing the needs of the community and then forming a community-wide plan to address those needs by implementing key strategies. And it also is actually undergoing a revision to ground it more in health equity and community power and really focusing on that engagement. So we're very excited about that. And then just a couple of other things. We have NACCHO University down here on the lower left, which is our learning management system, which I would just encourage you to go on there. We have a number of everything from recorded webinars to asynchronous trainings that might be of interest. So you might see something that you might just like to learn more about, like challenges with public health authority during COVID was one of the webinars that we did that's up there. And then there's some training such as change management, for example, that you could also take if you have the time. The National Profile of Local Health Departments and Forces of Change are two of our key research products that I just wanted to highlight, which if you want to just learn more about local health departments, learn more about what local health departments do and what kind of programs they're delivering in their communities, what are some of the challenges that they're facing as they're trying to do public health and address the 10 essential public health services. This is a really great way just to take kind of a deeper dive into that. We also have an annual conference called NACCHO 360. It is coming up in July this year in Denver. It will be really our first time, I think, fully back. So we are very excited for, I think, a very packed conference. We do record some of the sessions as well, and they're posted on NACCHO University. So certainly after July, if you're interested in seeing any of the plenaries or any of the town hall sessions, you should be able to view those as well. We also have a student chapter. So if you are a student, if you are going to be a student at university, I would definitely encourage you to consider joining our student chapter. It's really just a way to convene folks together, just to provide some additional resources, highlight some job opportunities at local health departments, and just provide some additional training for folks and answer some questions. And this is just a little bit more on that student website, which is on our virtual communities site, which I'll talk about in just a minute. So I love a checklist and I also love a call to action. So I'm giving you guys both. So what to do if you want to gather more information is number one, go to our website, nacho.org, and create a My NACCHO account. That is your key to the city to unlock all of these wonderful resources. When you are there, you will be asked if you want to sign up for any newsletters or listservs. We have many, so I wasn't going to go through all of them, but definitely if you're interested in environmental health, if you're interested in performance improvement, pretty much there's anything for a topic of interest, and you will just be put on a listserv to receive resources, webinars, sharing stories from the field, those kinds of things. The other thing is to join our virtual communities forum while you are on there, and that is where the student chapter is actually housed if you want to join that. But also virtual communities is kind of great unto itself. We have a main forum on there, which I believe is about up to 23,000 folks, mostly from health departments, for them to ask each other questions and to share resources from each other. So it's also just a great place to see what's going on in the field. And if you want to pose a question to a health department out there, this is a great place to do it. Once you have your My NACCHO account, you can also explore NACCHO University and take any of those courses. And then again, take the Roots of Health and Equity course. Again, if you're going to do one, I would definitely recommend that one. It is a really great process. And thank you very much. If you have any question on any of these resources or about NACCHO, about local health departments, please feel free to reach out. Happy to answer any questions.
Great. Thank you so much, Ashley. I have the pleasure now of introducing one additional partner who wasn't able to join us today. The CDC Foundation is another partner of us. They are an independent nonprofit and the only entity that was created by Congress to help support CDC. So their role is really to help define funding and private sector resources to support CDC and a lot of really exciting work that goes on around the country. So they are doing a fair amount with us here at the AmeriCorps, Public Health AmeriCorps Project too. And we'll make sure to introduce you sometime soon on another project that's coming up. So I, though, now have the really exciting opportunity, to tell you a little bit more about our annual meeting and the opportunity to join us in Atlanta for our annual meeting, November 12th to 15th. We are really fortunate that we have some funding to bring a cohort or a set of you all to our meeting. We have the conference, as Dr. Benjamin mentioned, has around 12,000 public health people. So it's a really big one, meaning there are all kinds of exciting different focus groups and webinars, chances to meet with people and do networking. We're really fortunate that as part of the meeting, we also are able to cover a scholarship. So we'll tell you about the application process in a minute, but we will be able to cover, your cost to join us at the meeting. We also thought it was really important that if joining something like a big public health scientific meeting, we wanted to let people hear about the work that you're doing, as well as letting those people that join us have a chance to really build that skill and the capacity to do a presentation at a scientific meeting among peers in public health. And so we will be coaching people throughout on both the application process and how to really develop a poster, what's important to include, how to get ready for answering questions. And we'll do that with all of our partners. So for the next few weeks, we're going to have some bi-weekly informational webinars. The next one we'll tell you in a minute at the beginning of May, but we'll really talk about the application. What would you need to do? What information would you include? And so for this one, because it's new, we don't get to bring everybody, but we're going to try to bring a good set of people that are doing different types of experiences in AmeriCorps who, tell us why they're interested in coming and make sure that we also can share with our public health audience the exciting opportunity that exists with Public Health AmeriCorps and hopefully get some good host sites and new people joining next year. The applications that we'll have for this will be due June 5th. They won't be really long, but it will let us have a chance just to learn from you, kind of about what you'd like to talk about and why going to a meeting like this seems like it would be of interest. So we will have these new webinars I told you about. Our next one is on May 1st. And so that one will really talk about kind of what is this meeting. We'll tell you more about it. We'll tell you about how you apply for the scholarship. And over time, we'll also talk about things like how can you make the most of a public health or any other kind of professional conference. You heard NACCHO, you heard NNPHI and ASTHO. We all have conferences. There are also conferences at the state and local level in public health that we'll be happy to tell you about. But these are all opportunities where you either now or in the future can go to learn more about meetings and how you can be part of them. And also what's important, since we want you to be part of this, is how we can, how to best write abstracts, which are just really short summaries of what you're planning on talking about at conference. For ours, they're usually around 250 words. And then how to develop a poster that you can talk about with a big group at a meeting. We also are excited that the people who come will really keep as a cohort so that you can learn about APHA, can learn a little bit more about some of the partners and how you network with them. So we hope it'll be fun, but also a good educational opportunity. I saw we have a couple questions on how would you apply for this. As Raya just said, the next meeting, so the one on May 1st, we'll see a little bit, we'll tell you more about the application process. but we will share it widely with AmeriCorps, and we'll send you out the links and everything as we have it. We'll also record all of these webinars so that you have a chance to learn from it if you aren't able to join us the day of the event. And with that, that's super high level. We're really excited, as you heard from all of us, to work with you, hopefully to help you learn a little bit more about our field of public health and to keep you engaged. And we're excited about these resources and opportunities coming up. I know we have a few minutes left, so why don't we open it up to questions, and you can both ask us in the chat, or you can email us later. You have our addresses. And you'll also see that Raya posted a post-event survey. So we'd also love to hear from you. How was this helpful? What else would you like to know? Does it make sense for us as a group to do this kind of thing in the future? And we're glad to have a chance to meet you today.
And Angie, if I could just jump in to just say thank you to you and the team for organizing this, and for all of our incredible partners who presented here today, and for all of the members who are on the line listening. First of all, thank you for your engagement. But second of all, I want you to leave this meeting feeling incredibly confident about your service and the value it's bringing not only to your community, but also to your own career. Folks are paying attention to what we're doing at Public Health AmeriCorps. We are rich in partnerships. We are rich in expertise. All of these folks, as you can see, have phenomenal resources for you, and they are rooting for you. And frankly, the number of questions I get about, when are you going to start having alumni? What are the alumni doing next? People are excited to see where you're going to go on your journey, and they want to be a part of it. So I hope you feel like really confident coming out of this meeting about the public health world and how excited they are about you and your service and your future in this field. I did see some questions about how we will get you the information on registration. So just keep reading those emails we're sending to you. They're full of opportunities, as you are probably beginning to realize. So register for that event, join the meeting, please apply for this scholarship. It's a great opportunity, and we're going to keep working hard on our team to find opportunities like this and get them to you. So but just huge thank you to all of our partners who presented today, and for everything you're doing behind the scenes to support Public Health AmeriCorps and our members. We absolutely could not do this without you.
So much. I don't know if people have questions quickly, but it's been a pleasure to really have a chance to meet with all of you, and for all of us to work together to tell you a little bit about what we do in public health. And I will also just say thank you to Raya, who you've seen lots of emails and texts from, but she helped pull this together for us. And one thing I would say is oh, go ahead.
I was just going to say, don't be shy to our members. If you do have questions, please raise your hand. We want to hear from you.
I will just highlight that there's one question in the Q&A portion. I'll quote it and put it in the chat as well, but is there any non-competitive job opportunities for jobs? So I think that's a great question for any of our partners who've shared all of their different and wonderful resources for finding jobs. And we will definitely share those as well post-webinar.
So maybe we each can share that in the webinar. I know that a couple of our groups have talked about doing some webinars on that also. So we'll certainly bring career opportunities, but I think a number of our different groups mentioned links they have that hopefully will help you to find some options also. Okay, well, I know this is over probably lunchtime for many of you and early in the day for others. So we will definitely ask a question about posting the form for scholarship. We will send it as soon as we have the link online. And we've had a couple of IT issues, but we'll get that out to you all over the next week or so. And we'll definitely make sure, as Cleo mentioned, that you get emails and other things about it. So everybody will find out with plenty of time to hopefully join our other webinars and find out about it. And one thing, about our conference, we also, all of these partners and, their members are usually part of it. So it's a chance, hopefully, to see all of our public health friends and faces there at one time.
Angie, if I could just say one last thing, which is people submitted really good questions when they registered. for this meeting. And I just want to say that we got those questions and we will work through them and make sure anything that wasn't covered today, you get that information moving forward. And don't be shy about continuing to send in those questions because it helps guide us in knowing what type of information you want to receive from us.
Great. With that, I know we're pretty much at time, so why don't we call it a day? Thank you so much for joining us, and we'll look forward to engaging with you over the rest of your AmeriCorps time. Thank you.